in the way that you think. We're going to be talking about COVID's effect and other things and how they affect your bone health. So we're going to be diving in deep into bone health. So if you've got questions you want to get answered tonight, make sure you go ahead and type those in and chime in early as opposed to late. Hey, and let me know where you're tuning in from in the world, and say hello, and don't be a stranger. So let's dive in to tonight's show. Now, we're going to be talking a little bit about gluten and bone loss, but we're going to talk about some other things as well. So it's not just going to be all about gluten. We will cover that information, though. Let's talk a little bit about bone loss. So many of you may be thinking, what does bone loss have to do with COVID? The big thing right now, the big thing that's going on for most people are the big lockdowns. And so depending on where you live in the world, if you don't live in Texas, not quite as bad of a lockdown, let's say, as like California or New York, but people are being locked in their houses. And the big thing that's happening is that lack of physical activity, and nothing degrades or increases the risk for bone deterioration more than lack of physical activity. So this is going to be one we're going to focus a little bit on. So those of you who may be in a kind of a more draconian area, I'm going to show you some things that you can do. So stay with me. I'm going to show you some things that you can do, even if you are in the lockdown, that are going to help with this. Additionally, one of the things that we know can impact bone loss right now is the alcohol consumption. So this is way up right now. So alcohol percent consumption is way up. Sales are way up. People are buying alcohol. Why? Because they're trying to cope, right? The stress of what they're experiencing is being treated, we'll just say self-treated, with alcohol. So depending on, some people take pain medication, some people take sleep medications to try to kind of shut themselves off, but a lot of folks are self-treating right now with different forms of alcohol. So again, alcohol increases bone loss for a number of reasons. It can cause nutritional deficiencies as being one of the main reasons. It causes the loss of water-soluble nutrients. It puts more pressure and stress on the liver, elevates blood sugar. Of course, all these things have been linked to an increased risk of bone loss. So these two things specifically, right now with what's happening with the lockdowns. So COVID lockdowns are generating a lot of lack of physical activity, generating a lot of alcohol use right now. Now, some of these other things, not so much, but we'll dive into them. So interestingly enough, bone loss risk factor also can be excessive exercise. So if you are overdoing it, we call that overtraining syndrome. It's when you can actually increase your risk for bone loss. Ladies, you're at greater risk than men just by the fact that you don't make the testosterone, you don't have the muscle mass, right? So smoking, hopefully nobody listening or tuning in tonight is doing any of that. And then a history of bone fractures is this kind of more if you've had this and you don't know why. And so maybe we should really specify this one by saying non-traumatic, specifically non-traumatic bone fractures. And when I say non-traumatic, I mean, like an accident, which is a form of trauma, but a light trauma. So like not like a car accident or something major, but just something like you fell back and you shouldn't have broken a bone. There wasn't enough pressure there. There wasn't enough weight there, but like a minor fall or something of that nature. But fracturing the bone in an easy way. So in essence, the bone fractured. If you've got that going on, this is something you're going to want to get checked out. If you've got a non-traumatic or a mildly traumatic injury that led to a fracture, you might already have accelerated bone loss. If you've got a family history of bone loss, you're at an increased risk. And then frequent pregnancies because of, this one is because of this one. So like frequent pregnancies, worst case scenarios that I see in women that have had multiple children, especially back-to-back children where there wasn't a gap, like a year or a 2-year gap in between pregnancies, is severe malnutrition. Some of the worst nutritional deficit lab work I've ever seen was from pregnant women who are going into a second pregnancy, or from pregnant women after breastfeeding, because baby takes it all. And so frequent pregnancies and nutritional deficiencies, super, super common. Now, this actually, COVID might be helping this one. because many of you have had a hard time getting to your doctors, and so maybe you haven't been able to refill some of your prescriptions. And so in that regard, this might actually be in your bone's favor, because if you look at here, medications that can actually contribute to bone loss, there's a long list of medicines that we know can contribute to bone loss. Statins, we know that statins can contribute to bone loss. Actually, statins are known to lower vitamin D, and of course, you need vitamin D. Vitamin D is as a nutrient. What it does is it tells your small intestine, tells the cells of your small intestine to absorb calcium. So statins, because they can contribute to vitamin D deficiency, can contribute to bone loss. The statins also lower CoQ10. We talked a little bit about this a couple of weeks ago, CoQ10 as being very important for your cell's ability to generate energy, and this includes your bone cells. And then blood pressure medications. Blood pressure medications deplete minerals. Many of them are the diuretics specifically. So if you're on like a thiazide diuretic, hydrochlorothiazide, or if you're on a potassium-sparing diuretic, these things can cause calcium and magnesium deficiencies. And then we've got steroids. Steroids also can contribute to calcium, magnesium, and vitamin D deficiencies. But steroids, also long-term steroids, drive up blood sugar. And, again, when you increase blood sugar, that increased acidity can actually put pressure or demineralize or lead to demineralization of your bone. So long-term steroid use. So those of you maybe that are on asthmatic inhalers, maybe those of you who are taking oral steroids for chronic things like chronic fatigue syndrome or things like fibromyalgia. A lot of times I'll see doctors who prescribe a lot of hormones, like a lot of your hormone centers. They give a lot of estrogen, progesterone, and they'll give corticosteroids at very low doses. But the problem is the longer you're on it, again, these things start to happen. So I see a lot of doctors prescribing these in low doses, not the high dose steroid packs that you get off of after 10 days, but the long-term use can lead to these types of problems. And then those of you with diabetes on diabetic medications, particularly metformin, for example, which is one of the more common ones, can lead to vitamin B12 deficiency, can lead to folate deficiency. You need both these B vitamins, very critical for bone building, for bone growth, and then also CoQ10 deficiency. So, again, the medications, the general mechanism here of action is that medications that cause bone loss predominantly do so by affecting nutrients. So it's very important. And the takeaway message, and I've talked about this a number of times over the last few weeks, the takeaway message here on this one should be for you, if you're being prescribed a medicine to treat a particular disease or symptom or syndrome, the conversation you should have with your doctor is, Doc, you're putting me on this medication. Talk to me about the vitamins, the minerals, the nutrients that might be interfered with or depleted as a result of being on this medication long term. Now, usually medications aren't a problem if we're talking about a couple of days. So like somebody maybe has a surgery and then they're using some Tylenol for a week after the surgery. That's not what we're talking about here. We're talking about the chronic use of medications over time. Again, most of these diseases listed here, most of these medicines are for chronic issues. So again, statins for hypercholesterol, right? Blood pressure, chronic. Steroids for chronic pain, diabetes, chronic disease. Blood thinners. If any of you have had a heart attack or stroke, a lot of times doctors keep you on blood thinner. I had somebody actually come in last week. They've been on blood thinners now for 2 years, and their doctor had no plan, no intention. Nobody even measured whether or not their blood was thick. They just had them on blood thinners. And, again, blood thinners in a woman who's over the age of 65 and gone through menopause, and just by the nature of being a woman and just by the nature of having malnutrition, now adding blood thinners, it's just one more element, right? It's one more issue, one more thing that can contribute to bone degradation. And the main one here, so again, if you're looking, the predominant blood thinner is heparin. So if your doctor's prescribed you heparin, talk to your doctor. If you are osteoporotic or if you've been diagnosed with bone loss, you might want to have that information. Anti-seizure medication. So if you've been diagnosed with epilepsy, seizure medications cause B12 deficiency, they cause B1 deficiency, they cause CoQ10 deficiency. And so again, can affect long-term the health of your bone. But actually, a number of studies have actually shown, even beyond these nutritional deficiencies, that this class of medication can actually increase the risk of fractures. And so that's where we're really concerned. And then, ladies, if you've ever been on progestin, especially so like Depo-Provera, which is the kind of medication that generally is injected, but it's a form of chemical progesterone, but it's progestin. And so this medication, this birth control, and sometimes I've seen women take it as a result of trying to like avoid having a child, but I've seen some women take it for years, and that's the problem during their formative bone years. Remember, your formative bone years, ladies, you're going to hit your peak bone density somewhere around the age of 35. And so if you're on birth control from the age, let's just say of 16, up to the time where you're getting ready to maybe get married and think about having or starting a family, in some cases, I've seen women on this for multiple years, right? 10 plus years. And so that's where you really run that risk. And that's during formative bone density years. You don't want to necessarily do that to your bone. There are other options for birth control. And then this is another really common one. And so this one doesn't have anything to do with nutritional deficiencies, but thyroid medication, if your dose is too high, you can actually contribute to bone loss. And I get this a lot. It's one of the reasons why I wanted to list it here, because many of you, as a matter of fact, how many of you watching the show tonight are taking thyroid medication? And so if you are, pay really close attention, because if you're taking thyroid medication, here's the thing. If your doctor is saying, hey, we're just going to monitor, this every once in a while, that might not be a great idea. My advice is, if you're on a thyroid medication and you're trying to figure out, and your doctor's working with you, try to figure out what that dose is, oftentimes your TSH will come back under less than 0.5. And so I've seen this be the case. So 0.5 is considered too strong of a medication. So again, if you're taking a medication, the lower your TSH below 0.5, that means your medication might be too strong. And so if you're waiting a year or 2 years in between getting it checked, getting this TSH checked, because most doctors, they won't check your T3 or T4. They predominantly will, if you're not working with somebody in functional medicine, they'll predominantly only measure your TSH. And so if you're going big gaps of time and you don't even know it, and let's say your TSH is under that 0.5, I see cases where sometimes it's like 0.01 ... which is much, much lower. Like these are problems because, again, too much thyroid medication that dose being too high is going to definitely contribute to bone loss, aside from other problems. Like too much thyroid medication can also contribute to heart disease, heart problems, can put too much pressure on your heart. It can disrupt sleep, and it can cause hyperanxiety. I see a lot of women too, after going on these medications, developing anxiety because their doctor wasn't monitoring their TSH aggressively enough. And so in the first year of being on any kind of thyroid medication, you really want to, my advice to you would be to ask your doctor to check this, 3 to 4 times during that first year, so that you get a good idea. Is that too low? Is it too high? Where's it at? So that you're not contributing potentially to too strong a medication causing bone loss for you. So these major medications, all known to contribute to a deterioration of bone, either through direct increased risk for fractures, or through nutritional deficiencies, or through the direct mechanism of action of the drug itself. Now, let's talk a little bit here about gluten. I'll pull up this diagram for you. So let's move you out of the way. So this diagram is just kind of a representation of some of the different ways that gluten can create or contribute to bone loss. And oftentimes people aren't aware of this. So there's 2 types of gluten sensitivity that most people think about, or most doctors think about. One is what's called non-celiac gluten sensitivity, and the other is celiac disease directly. And so it's been very well established that individuals with celiac disease suffer greatly from malabsorption. And so if you've got a diagnosis of celiac disease, you probably got that diagnosis because you went into your doctor because you were having either chronic diarrhea or chronic gastrointestinal pain, or just wasting. You were losing weight. This is how most people get a diagnosis of celiac disease. And so they probably did a biopsy, intestinal biopsy, and they found something called villus atrophy. Again, it's the villus atrophy that causes the malabsorption, which leads to the nutrient deficiencies, which subsequently leads to the inability for your body to mineralize the bone appropriately because you're not getting adequate quantities. So celiac disease, largely studied, and we know directly that it's linked to malabsorption, but there's some new information that's come out recently, published in the New England Journal, showing that people with celiac disease actually can produce antibodies against a protein, and this protein, so it's a protein called osteoprotegrin, and this protein prevents the breakdown of bone. And so what the authors of this research study kind of concluded is that not only is celiac disease being an autoimmune condition, right, where your immune system attacks the small intestine, but what they're concluding here is that not only can gluten contribute to the development of the celiac disease with the malabsorption, but there's also suspicion that the gluten causes antibodies against osteoprotegrin, and those antibodies, again, they destroy a protein that helps preserve your bone. And so where we'll see this, where we suspect this the most, is in somebody who's got really advanced osteoporosis at a really young age. So like if you're in your 30s and you're already being told that you have severe bone loss, this is a potential possibility, again, if you have a pre-existing celiac disease diagnosis. But even if you do have a non-celiac gluten sensitivity diagnosis, again, it's the gluten itself that can contribute to the production of these antibodies. So you don't necessarily have to have celiac disease. So again, this is an autoimmune type of response, right? And so that's what this is referring to. So gluten sensitivity, immune reaction, leading to the antibody production, again, against osteoprotegrin, which then leads to the development of autoimmune disease, i.e. this bone loss that shows up. And generally, this is a more aggressive type earlier onset, whereas, traditionally osteoporosis doesn't show up until somebody's, in their 6th, 7th, 8th decade of life, where it's just not an early person's disease, but where we see advanced autoimmunity or early stage or early onset bone loss. This is something that you definitely want to consider. So maybe you've been told you've got bone loss, aggressive early bone loss, but nobody's ever measured you or tested you for gluten sensitivity or celiac disease. Very important takeaway here. So we know, again, that gluten creates malabsorption. It can create an immune response. It can also directly, it can cause inflammation. So, this is one of those things, that gluten-induced inflammation in and of itself, chronic inflammation, it can damage your tissue and lead to lost resources. So why does inflammation cause bone loss? I talked about some of this the other day, but it drives up cortisol. So I really want this to make sense for you. So it drives up cortisol. What did we say over here? We said steroids increase the loss of calcium, magnesium, vitamin D, and increase your blood sugar. And secondarily to that, actually increase the risk for the development of fractures, but are known to cause bone loss. The steroids, right? And when we're talking about steroids here, what kind of steroid are we talking about? We're talking about corticosteroids. So the steroids of stress, which are produced by your adrenal glands. When we're inflamed, our body produces more cortisol. And if we're chronically inflamed, in essence, if we are eating gluten every day and we're chronically inflamed from that gluten over time, the cortisol stays high over time, and that can drive, again, it can drive that bone loss from tissue damage. Remember, cortisol is a catabolic steroid, so it breaks down bone. It also breaks down muscle tissue. So it's not just your bone, but also your muscle. And that again, when your muscle is breaking down, muscle puts pressure on bone. And so again, there's a law in physiology. It's called Wolff's Law. And Wolff's Law states that bone grows, the density of bone grows based on pressure. So if your muscles are atrophied because of chronic steroid elevations or chronic steroid use, then there's less pressure on your bones overall, unless you're obese. Now, if this is happening and you're obese, so a lot of people with gluten sensitivity are too thin. They can't put weight on. But many people are also overweight. So depending on how gluten is affecting you, if you're overweight, that is putting pressure on your bone. But if you're underweight and you're malnourished and you're driving that inflammation, you're losing that muscle mass, this is where we're going to see that earlier onset osteoporosis. So all three of these ways. So we've got, again, immune responses, malabsorption, and then just generalized inflammation can all contribute to a bone loss or an osteoporosis over time. So moving this out of the way, let's talk about some of the nutrients that are super critical for bone health. Let's get that out of the way here. There we go. So now this is not intended to be a comprehensive list of every nutrient that's necessary for bones, but this is really kind of a big list of some of the main ones. And the reason why they're here is because these generally are nutrients that we know for certain that gluten can induce deficiencies of. So this top one up here, although not a micronutrient, it's a macronutrient. It's protein. Now, you remember, protein provides collagen, and collagen is the framework for bone. So, most people think about bone and they jump right to calcium. They're like, bone's calcium, right? It's almost like synonymous. But bone, more than calcium, bone is collagen fibers. And these collagen fibers, they crisscross and they form what's called a triple helix. So it's almost like DNA, but with one extra strand. And in between each of these strands are what are called collagen crosslinks. So imagine this, what I'm showing you is kind of blown up, but imagine this on a very microscopic level. And so this pattern of collagen, as it's forming, it forms what are called trabeculae, which are these matrices of bone interweaving so that you have strong areas of bone pattern in areas where there's greatest pressure. So like when we look at bone under a microscope, or when we do an autopsy, or when we cut bone open, we'll see the bone being thicker in areas where there's generally more pressure, like the angle of the femur in your hip, for example. But it's made out of collagen. And so what happens is that protein, you got to have enough protein. In essence, you got to have enough collagen coming in through your diet to get the building block or the backbone of your bone. And so subsequently to that, things like calcium, okay, and magnesium and boron and vanadium and selenium, they mineralize this matrix. So they where collagen by itself is very elastic and very stretchy, once you push those minerals in there, when your body pushes those minerals in there, it makes the bone a little bit harder so that it's not just a sponge that just bends. If you've ever seen, for example, a child with rickets, rickets is a disease in kids that have vitamin D deficiency when their bones are forming and developing, and they end up with very bowed legs. So like, I'm a terrible artist, but if you've got a kid and then their legs, they bow out. And again, I'm not a great artist. That's my stick figure rendition of rickets. So the legs bow out, and you'll see it. It's very obvious because they'll have a bow when they walk. That means when they were a child, they had vitamin D deficiency. Remember, vitamin D helps get calcium and magnesium into the bone. It helps you actually absorb them from your diet. So if you're not absorbing them from your diet, it never makes it to the bone, and the bones are too soft and they start to bow. So kind of think of it as almost like Goldilocks and the Three Bears. We don't want the bones too hard. We don't want them too soft. We want them just right. And this is where these nutrients come into play. So you've got, iron and calcium and zinc and magnesium and selenium all mineralizing into that bone and making it, again, pliable but strong and resilient. And then you've got other nutrients like vitamin C and vitamin K and vitamin D. Again, vitamin D plays a role in allowing the minerals to be absorbed. Vitamin C forms these crosslinks. So I said earlier, these collagen crosslinks, it's what makes collagen strong and stretchy and elastic, keeps it from fraying. Those crosslinks are basically produced as a result of vitamin C. Now, you also need copper. Again, copper's not on this list, but copper is also very important for bone health. So you need copper and vitamin C to make those crosslinks. And so very, very important for the strength and integrity of your bone. And then you need vitamin K as well. Vitamin K helps. So whereas vitamin D helps get calcium absorbed from the food that you're eating, vitamin K helps push the calcium, once it's in your bloodstream, into the bone itself. So vitamin K also critical for bone health, as are B vitamins. So I mentioned earlier metformin. We were talking about that diabetic medication that caused B vitamin deficiency. And I was talking about vitamin B12 and folate, because those two B vitamins are, affected by that class of medication. And so what happens when B12 and folate are reduced is your homocysteine levels will increase. Now, homocysteine is a chemical. Any doctor can measure it in the blood, and it's generally linked to heart disease. So a lot of people look at homocysteine and they think, okay, you have an increased risk for the development of heart disease. But homocysteine can increase your risk for reducing bone. So it's actually been linked, homocysteine's been linked to bone loss as well. So it's not just something that we can measure to assess risk for heart disease. It's something we can also measure to assess the risk for the development of bone loss as well. And that's why you see, well, you don't see it. I have boron on here, but we should probably put B vitamins on this diagram. Again, as I said earlier, this was not intended to be a full and comprehensive diagram, but I wanted to give you an idea for some of the really important ones. So again, your bone matrix is largely made up by building blocks of protein, collagen, and then mineralized to become stronger through different minerals. And so all of that dependent upon nutrients coming from the diet. So if you're not getting those nutrients, you're in trouble. And gluten can cause a deficit or an inability to absorb those nutrients. And so, and just like a poor diet can as well. So if you're eating the kind of the fast food, we want to really talk about COVID some more. I know many of you are burned out on the topic, but a lot of people are eating a lot of junk right now. Like, that's part of the stress is some people are eating at home, and so they're eating a lot healthier, but a lot of people are going and they're ordering, they're using these food ordering services, and they're just ordering junk. And of course, what you put into your body, it manifests in your strength and your integrity and your nutritional status. So if you aren't eating well, your bone's definitely going to suffer as well. Okay. One of the things that I hear commonly, people tell me, look, I'm exercising, and they're not really exercising. To build bone, to get strong bone, you need resistance. And walking is not so much a form of resistance. So keep in mind that we define walking as movement, not as a form of resistance exercise. Very important, because a lot of you are walking, but there is no resistance exercise in your life. I talk to people every week that come to see me that, they say, when we ask them about exercise, yeah, I walk all the time. And walking is not going to increase your bone density to any great degree. So again, it's not enough to restore bone health, especially if you have bone loss. So we have to think about, how can you build muscle? Remember what I said earlier. I said that bone follows Wolff's law. Wolff law, that means pressure on the bone makes it more dense. Okay, so it sends genetic, increased pressure through exercise sends genetic messages to your DNA, right, to increase the density of your bone by allowing your bone to resorb more nutrients necessary to make it thicker and denser. So Wolff's law is very important. And so if we're going to consider exercise, we can't consider walking, and really not even something like a treadmill or a recombinant bike. Now, don't get me wrong, those things can be helpful. But unless you're turning the resistance way up, so like if you're on a bike and you're just kind of coasting and you're not even breaking a sweat, you're not going to do a whole lot so much for your bone. If you're on one of those elliptical walkers and it's at the lowest setting and you're just kind of cruising through, going through the motions, it's not really going to do a whole lot for you. Now, if you crank up the resistance on those machines, again, that resistance is going to be a form, keyword, resistance exercise. So that's going to be effective. Now, some of my favorite things to do to help people reestablish good health, but also increase their bone density, are high intensity interval training workouts. So things like squats. So this is all body weight, right? So squats, push-ups, pull-ups, lunges, sit-ups, Kettlebell's not a body weight, but you don't have to swing a super heavy kettlebell. You can do a lot with a kettlebell. There are 100 exercises you can do with a kettlebell that qualify as a solid resistance exercise. Plank holds, jumping jacks, jump ropes. So if you look at this list, there's a reason why I picked these 9. It's because minus pull-ups and minus the kettlebell and minus the jump rope, these you don't need any equipment, right? You don't need any equipment to do a squat, a push-up, a pull-up, or a sit-up, a lunge, a plank, or a jumping jack. Now, these 3, you need a pull-up bar, you need a kettlebell, and you need a jump rope. But for the cost of your monthly membership to a health club, you could probably purchase all 3 really inexpensively. So, in that regard, these are very easy things. They don't take up a lot of space or a lot of room. You can do them at home. So like many of you, again, going back to many of you are in lockdown right now, and your gyms are closed. Your gym membership has been, postponed, and you're just not taking care of yourselves. And you're thinking, well, what can I do? And this is what you can do. You can do body weight activities that don't require a lot of space, that don't require a lot of equipment, but have a lot of potential power to really help increase the cortical density and the thickness of your bone. Now, there are different patterns for exercise. So like, I'm trying to share some ideas with you tonight, because I think many people get hung up on the idea part, right? It's okay, what do I do? Do I do 10 push-ups? Do I do 5 squats? Like, what are we talking about here? One of the most powerful ways to apply this style of exercise is called a Tabata. Now, Tabata is not an exercise. Tabata is the name of a researcher who set out to discover how much exercise was necessary for people to be healthy. So what he was trying to figure out was, what's the least amount of exercise a person needed to do in order to be healthy, in order to support bone growth, muscle growth, etc. And so he wanted to know, kind of think of it like this, the minimal effective dose of exercise to get the maximum effect. And so what he discovered was it was about 8 minutes a day. And most people exercise way more than 8 minutes a day when they're going to their gym. They're in there an hour and a half, like they're just on the elliptical for 30 minutes, and they're exercising way more than they need. Now, let's define exercise. So Tabata is not like a style of exercise where you rest a lot. Tabata is broken up into 2 parts. There's 2 4-minute routines, and that's where you get 8 minutes. So a 4 minutes, so I'm going to give you an example. Tabata is 20 seconds of work followed by 10 seconds of rest. So, and you do that for 4 minutes. So this pattern is 20 seconds of work, 10 seconds of rest for 4 minutes. And so what exercise do? You fill in the blank. Pick any one of these things. You could do a Tabata squat exercise. You could do a Tabata push-up. So again, the premise would be, if you were going to do, let's just pick the push-up. You do 20 seconds of push-ups followed by 10 seconds of rest, and you repeat that pattern for 4 minutes. So you're basically going to go through 8 rounds of push-ups at 20 seconds. And what you'll find, if you've never done this before, first of all, it's going to make you super sore, and it's going to be a fantastic workout for you. But second of all, what you're going to find is it's a lot harder than it sounds. Most of you, maybe if you've never done this and you can't fathom a 4-minute push-up workout, but what happens is this 20 seconds of work doesn't seem like a lot, but in the reality is in the middle of this workout, this 10 seconds of rest doesn't seem like enough. And so you're putting in those push-ups, and then the rest period comes, and there's just not enough time to fully recover. And that's the magic of a Tabata, is you don't want to fully recover, because when you give yourself enough rest to fully recover, you're actually losing some of the benefit of that bone and muscle building hormone release that's going to occur as a result of doing this type of exercise. So my advice would be, if you're struggling with bone loss, or you're struggling with muscle density issues, you don't have enough muscle mass. So this is whether you have bone loss or whether you just want to try to put on some lean muscle mass, but not, again, this is not going to build Herculean size. You're not going to become Arnold Schwarzenegger doing Tabata, body weight exercises. What we're after, though, is lean body mass, because that's what prolongs lifespan, and that's what prolongs quality of life. But that's also what reduces your risk for developing a number of diseases, not just bone loss, but also diseases like cancer and heart disease and diabetes. So if you want to give yourself protection from the chronic degenerative diseases, and you're in this lockdown and your gym membership's canceled, and you're like, what am I going to do? There's nowhere to work out. You don't need space. You need like a 6x6 space to do everything on this list, and you don't really need a lot of equipment. And now you're out of excuses. You've got exercises that you can do that are relatively simple enough that anyone can do them, and you've got a pattern in which to do them with. So a 4-minute pattern of 20 seconds of work, 10 seconds of rest to build and strengthen your muscle, but also to build your bone. So this is an 8-minute routine. So my advice is pick that first routine should be something for your upper body. So like pick the push-up, again, the push-up, for example. And if you can't do pull-ups, and many of you may not be able to do pull-ups, they are a little bit more of a challenging exercise. You can do pull-downs, so get you some of that stretch tubing. Again, you can get some for just a couple of dollars. It's real inexpensive. And you can wrap it around a pull-up bar, and you can do pull-downs instead of pull-ups. And those TheraBands, those resistance bands are graded for different weights. So you can buy them that are 10-pound bands or 20-pound or 30-pound bands, etc. And you can buy the weight that matches your ability, it matches your strength. The key here is stay with your fitness level. Body weight is one of the best ways to do that. So the pattern is pick an upper body exercise for the first routine and pick a lower body for the second. And that way you're not just neglecting, large muscle groups. So, and we rotate it. So like if today you did a push-up and a squat, maybe tomorrow you do a kettlebell swing and a lunge. So again, you rotate your movements. You don't do the same movements every day. And these are just 9 exercise examples. There certainly are a number of different things that can be done. If you've got, light dumbbells, you can do things like shoulder presses or arm curls. The sky is the limit with this. What I'm trying to do is give you a pattern and a lack of excuses so that you can get to work on this. So when you're doing that first 4 minutes, and when you're done, you want a little rest break. So you want to rest for 4 minutes in between before you pick up on that second one. So it's a 4-minute Tabata workout, a 4-minute rest, and then a 4-minute workout. And so you're largely done in 12 minutes. Now, technically you're not fully done in 12 minutes because you probably want to warm up a little bit. You don't want to just go and start exercising on cold muscles. So you kind of want to warm up a little bit. If you've got a rebounder trampoline, that's a great way to warm up. If you've got a jump rope, that's another really good way, just jumping rope, do 50 jump ropes, get your body loosened up and warmed up a little bit before you just jump into one of these Tabata type of routines. Because about 2 minutes into this Tabata, you're going to be screaming. But remember when you're screaming to yourself, oh my gosh, can I keep going? It's only 4 minutes. You just have to get through that 4 minutes. So again, this is hands down, this is the number one way. If you want to rebuild bone, if you want to rebuild bone density, this is where it's at. This is better than any supplement. It's better than any formula. It's better than any product that you can take. When you combine this style of activity and exercise with good diet and good sleep and good stress management and sunshine, that's what you need the most to restore your bone. You don't need medications. A lot of doctors specifically want to put people on, the bisphosphonate medications, and those drugs. One of the side effects of those drugs, as I was talking about collagen earlier, they don't really make your bone stronger. They make your bone more brittle. What they do is those drugs they push more calcium into that matrix, so they're just pushing more mineral into the bone, so they're making the bone more brittle. And I've talked about this before, and you can go back and watch, if you want to watch my video, you can search it under bone loss myths. But those bisphosphonate drugs make your bone brittle, not stronger. And so it actually can increase your risk for fractures. And one of the fractures that those drugs cause are fractures of your jawline. And so there's a name for that. It's called osteonecrosis or osteonecrotic jaw. And you don't want to develop that, because if you fracture your jaw, now you can't chew your food. Remember, one of the key elements to building strong bone and healthy bone is eating good food. So you want to make sure that you're not taking, you can't fix your bone with chemicals. You can only fix it with what God gave you, which is solid food, the ability to sleep, the ability to move your body. So those are the things that you really want to focus on if you want to do well. Otherwise, you'll be sorely disappointed in the outcome. I think I was reading a couple years ago, there was a research study published on the top 10 drugs that doctors would not take even though they prescribed them. And bisphosphonates, the bone loss drugs, were number one on the list. Why do you think that is? It's kind of a scary thing when you think about it. Okay, so let's answer some questions. Is ionized calcium a good test for hypocalcemia? I mean, yes, it is. I mean, but you have to understand, Juan, that calcium becoming low in the blood, your body's really good at not letting that happen. And here's why. Your calcium levels drop too much, it will kill you. So your body has adapted. It's adapted to, you have a gland next to your thyroid or beside your thyroid called the parathyroid gland. And so it makes parathyroid hormone, or PTH. And the PTH travels to your bone and it tells your bone to release calcium. So what happens is, for most people, is that we're not going to measure low calcium in the blood, because the parathyroid, if it's working properly, is going to break the bone down to get access to the calcium from the bone, and it's going to keep the blood calcium levels nice and stable, because again, that's a life-threatening situation if calcium were to drop too low. So it's if by the time you're seeing hypocalcemia on a blood test, this has been going on a while and you probably got bigger problems. So it's not the best test. The best test to really measure for calcium, if you're really trying to look at calcium, is intracellular analysis. So looking inside the cells, not necessarily looking inside the serum. Now, it's also good to get both. So get a serum level, but also get an intracellular level. That way you have both compartments that can be looked at. Okay. At what age should women have bone density tests? Great question, Melanie. I really don't recommend bone density tests. Let me explain why. Actually, I want you to do something. I want you to go back and watch my video on bone loss myths, because I talk all about bone scans. For about 45 minutes, I talk about bone scans and why they're not really all that great. But the simple answer is, bone density scans don't measure bone health. They measure how well your bones absorb X-ray. That's all they're measuring. And how well bones absorb X-ray it's not a marker for bone health. And so a lot of times what happens is if a woman gets into menopause, they're, in their upper 40s, 50s, they're getting a bone scan done and the doctor's saying, oh my gosh, you've got bone loss. You have to understand the bone scan is based on those numbers. These are what's called a standard deviation bell curve to calculate the numbers. But those numbers are based on 35-year-old females. And if you're 50 or 60, know that bone density scan is comparing you to a 35-year-old. So it's not a fair comparison. So I just don't really recommend looking at bone density scans as the end-all be-all of evaluating bone health. There certainly are better tests. So if you're looking for tests that you can ask your doctor to run, ask them to run all those nutrients that we just talked about: the calcium, the magnesium, the zinc, the selenium, the copper, the chromium, the B vitamins, etc. Ask them to run that. Ask them to look at that, because if your nutrition is off, then your bone health is not going to be potentially not going to be adequate. There's also a couple of urine tests that can be run that measure how fast your bone is breaking down versus how fast it's building. And those tests, one of them is called osteocalcin. The other one is called a pyridinium crosslink test. So those are tests that your doctor can measure, that your doctor can order. They may look at you funny when you ask for it, because most doctors don't, they're just not ordering these types of tests. They're all kind of fixated on bone density scanners. And I honestly, I don't know why. I've never really used them. I've never really referred people out to them, because they just aren't great assessments of bone health. And so we really want to know about bone health, not how well your bone absorbs X-rays. Let's see here. Question coming in. How do you slow bone loss when you have to take medications? It's a good question, but I'm going to throw this out at you too. I'm going to say, why are you having to take medications is probably the better question to ask, right? I mean, it depends on what you're taking medications for, but most people taking medicine for chronic disease, they need to have a different conversation with their doctor about why they have chronic disease, because medicines don't cure disease. I mean, hopefully that's not a newsflash. Medicines alter your biochemistry to change your symptoms of what you're feeling, or the symptoms of how your body is feeling. So for example, if you have high blood pressure, you take a blood pressure medication, it reduces your blood pressure. Your blood pressure being high is a symptom, but why is it high? Okay, same thing with your blood sugar. If you're taking a drug to lower your blood sugar, why is it high in the first place? So remember, if you're taking medicines, you have to ask the question, why am I on these medicines? Don't think about what else I can do, what else I can take to continue to justify taking these medicines. Ask the bigger and more important question, which is, why am I being put on these medications when there's probably a diet and a lifestyle change that I could make that's going to lead to a resolution of the need for those medications? And if you haven't already, pick up a copy of No Gray, No Pain. There's a lot of information in that book that might help you navigate the waters of chronic disease a little bit better. Let's see here. So I think I may have answered that. So again, suggestions for best tests that check bone density. If we're again, not checking bone density, but checking bone health. And I think that's the important thing to realize, is that bone density is one aspect of health. And so a good bone x-ray can tell you about bone density, because if you've got a good doctor that knows how to look at an x-ray and read an x-ray, that can actually evaluate and see early bone loss on x-rays. You can do a bone scan. I said I don't recommend them because I don't like the emphasis that they put on people. I think they stress people out more than they help people, because they get people in the mindset that they have bad bone. But remember, if you're over 45, 50 years old, you don't want to compare yourself to a 35-year-old. It's not a fair comparison. So it really isn't, to me, it's the test itself, you have to take it with a grain of salt. But osteocalcin and deoxypyridinoline are two tests that measure bone turnover, and they're urine tests, so they're non-invasive, and there's no radiation with them. So those are really safe ones to assess, again, how fast your bone is building versus how fast it's breaking down. So those are great screening tools to begin the thought process of, do you have a bone loss problem creeping in? Let's see here. Somebody's asking about Paget's disease. Could gluten have played a role in Paget's disease? Yes, it could have. I've actually seen some studies that show a connection between the two. Next question: what about elevated CPK, creatine phosphokinase, in relationship to inflammation? So CPK, yeah, I mean it's an indirect measure that bone could be breaking down or that muscle could be breaking down, and so it can be an assessment. But it's not a direct assessment. It's an indirect assessment. It doesn't tell you, it tells you that there's a problem, but it doesn't tell you what the problem is, not specifically. Whole body vibration, somebody's asking about. Love it. I've got a vibration plate in my garage where I have my gym equipment too. So whole body vibration is a great way to build bone. These are platforms you can stand on and do different exercises on that actually oscillate at different frequencies that can help to stimulate bone. The platforms were actually developed by the Russian space program, because when the cosmonauts would come back from being in the space station for months on end, of course, with no gravity environments, you have a reduction in bone mass. And so to rehab them back, the technology was developed to expedite that in a quicker fashion. So yes, I really, really like whole body vibration units as a general. You can do squats on them. You can do push-ups with them. I mean, again, you can do a number of these body weight exercises that I talked about on this other page over here, and you can do those on a vibration platform, and you can make your exercise even more effective. Okay, how to deal with bone spurs. So Tammy wants to know. So Tammy, remember that bone spurs, like if you've got them in your spine, probably one of the best things you can do is see a good chiropractor. But if you've got like a heel spur, for example, like a bone heel spur, one of the top causes of heel spurs, and again, I don't know if this is specifically your question, are tight calf muscles. So remember, bone grows based on pressure. So if there's increased pressure on the bone, the big part of identifying how to deal with the bone spur is finding out how that abnormal pressure is being put on the bone. So like a lot of times with x-rays of people's necks, we'll see bone spurs coming off the vertebrae, and those bone spurs are signs of abnormal posture or abnormal head position over time. So like if somebody's at a computer screen all day long and the abnormal pressure and force from gravity and the weight of the head, which weighs about 16 pounds, is coming down, they can form spurs in different areas. And so the way you would get rid of those or help the body resorb those is to correct the postural imbalance and to correct the behavior. Same thing with heel spurs. Heel spurs are generally very, very tight Achilles tendon and calf muscles. So if you can't palm the floor, if you can't bend over and put your palms on the floor, then your calves and your hamstrings are probably way too tight. And this happens to a lot of people who sit at a computer desk all day long. So the focus might be stretching out your hamstrings and stretching out your calf muscles a lot more aggressively or a lot more consistently to take that pressure. Again, that tight muscle pulls on that bone, on that heel, and it can create that spur. So again, just depending on where your bone spurs are, it's finding where the abnormal pressure is coming from and then adjusting the behavior around it. Okay. Will vitamin D build bone? Vitamin D is not necessarily building bone, but it's helping mineralize bone. So again, vitamin D tells your small intestinal cells to absorb calcium. And without vitamin D, your small intestine doesn't do a very good job of absorbing that calcium. And so subsequently, your bone will break down. Is coral calcium a good source of calcium? No. If we're talking about supplementation, if you're looking for solid calcium supplementation, really probably one of the best forms is calcium citrate. Calcium citrate, calcium malate, these are amino acid chelate versions of calcium, but your body can absorb them better. Whereas typically coral calcium, it's got a lot of calcium in it, but that calcium that's in it is not widely and highly bioavailable. It's harder to digest and assimilate. COVID question. So I'm taking quercetin, zinc, C, D3 along with cutting out the simple carbs and exercising. Do you personally know anyone who's contracted a severe case of COVID? Several have called into me that have and have done very well with those nutrients and not needing to go on into the hospital and progress to a very bad state. So yes, I do personally know people that have contracted it that do well with nutrition. Now, that being said, I will just put in this disclaimer. There are no known cures, treatments, potions, or lotions that you can take to treat COVID-19. And so, take that, for what it's worth. Can high dose vitamin D remodel joints? No. Again, high dose vitamin D is going to increase calcium absorption. It's not going to remodel your joints. What's going to remodel your joints is, again, the fundamentals of health: good sleep, good exercise, good food, good sunshine, clean air, clean water, and modulating and controlling your stress levels. Those are the things that will remodel your joints. I know I see a lot of people that come in and that their other doctors have said you're bone on bone, or they said you have you have no joint space left, or your joints are just basically arthritic. And they overstate the arthritic nature of their joints, and they tell them it's not, you can't heal it, you don't recover, arthritis is permanent. And that's just not true in my experience. I've seen a number of people come in with arthritic joints, and when they start changing their diet and their lifestyle, losing weight, taking care of their bodies, their joints, just like the skin, if you get a cut, it naturally heals and repairs itself. Your joints can do the same thing if you take good care of them. Now, you can let it go too far, certainly, and there are people that have let it go too far where the joints are not going to make a full comeback. But that doesn't mean that you still can't make changes, meaningful changes that improve your overall joint health. Can I claim compensation if a hospital missed my fracture? That's between you and a lawyer. I don't know. I mean, I don't know. That really is between you and the lawyer. If it was undiagnosed and untreated, I would go back to the doctor who missed it. And but I mean, I'm not a big fan of the lawsuit like that. And frankly, the reason why is it doesn't accomplish anything. It doesn't move you forward. It keeps you in a state mentally and emotionally where you're just you're angry, right? And that's hard to overcome. And that's hard to move on, and that's hard to heal when you're angry all the time. If you're again, now if you need compensation because you need to be able to seek out medical treatment, again, that's something you might just consult an attorney with. And I would talk to the doctor who missed the diagnosis. He's a human too. Doctors make mistakes. And, if it's not a totally life-threatening, life-altering mistake, I mean, they're just like anyone else. They can make a mistake. They can miss a fracture. They can miss I'm not saying it's great, but, it does happen. Can infections contribute to hip pain? They sure can. If you've got chronic hip pain, one of the best things to do is ask your doctor to x-ray your hip. Sometimes you can see an infection in the bone off of an x-ray. So infections definitely are a potential cause for hip pain. Not the only cause, but definitely can. Collagen supplementation, can that assist in joint health? It absolutely can. Collagen can be very effective. Many people don't eat the collagen from the food. So, when you're eating just animal meat tissue, so those of you who aren't vegetarian or vegan, if you're a meat eater and you're just eating the meat, but you're not eating the bone or the bone marrow, you're not using the bone broth, like a lot of the collagen sits in that tissue. And so most people don't gnaw the cartilage off of a chicken drumstick, for example, which is where a lot of that, that collagen would be if you were eating it in the diet. So collagen supplementation can be a great way to get that collagen in. Can hip pain be something serious? It absolutely can be. Hip pain, hip is an area where you can have infections, you can have tumors, you can have fractures. You could have a serious problem if you have chronic hip pain. That's why it's always a good idea to follow up with a good doc and, have some orthopedic testing, possibly some imaging done to see what's going on internally. But yes, hip pain can also be not serious. Hip pain can be muscle imbalance. Hip pain can be that the joint itself is not lining up properly. So, there are a number of reasons hip pain can occur. Some of them are more serious. Some of them are less so serious, but I guess it just depends on you. If you're the one having the pain, it's probably serious, but you probably wouldn't want the diagnosis, say, of a bone infection versus, say, a muscle imbalance is a lot easier to correct, a lot less invasive. Let's see. Nancy says, since gluten is gone, arthritis is manageable. I love it. I'm waiting for your book still, but I ordered it from a tiny bookshop and she ordered one for herself. I convinced her. Awesome, Nancy. Thanks. Yeah, the more we can spread the word, the more people we can help. Can gluten sensitivity cause scoliosis? Theoretically it could. I haven't seen any great research and haven't seen any great correlation on that, but there are different forms of scoliosis as well. There are kind of more advanced congenitally developed scoliosis situations where, for example, when somebody is born and their vertebrae is like a congenital defect of the vertebrae itself, and so it puts the spine in an abnormal lining position, and so over time as they're growing, scoliosis can become more advanced. Is it possible that gluten could have contributed to the bone abnormality? It's plausible. Again, I haven't seen any great compelling evidence or research, nor have I seen anybody in my practice where I could say, yeah, gluten caused that person's scoliosis definitively. So I would err more to the side of the caution of, if you've got scoliosis and you're looking for a cause, for many people it's muscular imbalance, it's chronic positioning. And so if you get with like a good chiropractor, a good physical therapist, somebody who really deals with a lot of scoliosis would be your best bet. Fred wants to know if I recommend calcium supplements for bone health, or should you focus on other things like collagen and vitamin D? It depends, Fred. Again, going back to what supplements do I recommend everybody take? At the end of the day, I recommend everybody take a multivitamin. A multivitamin that contains vitamins and minerals, not necessarily in mega doses, but in decent doses as an insurance plan to good food. Because if you're eating good food, you should be getting good nutrition. Now, sometimes a person needs to be supplemented with therapeutic doses of a nutrient. And so to make that decision, my advice is ask your doctor to measure it, test it. Because can calcium be helpful? Absolutely. One of the most common things that we see with calcium deficiency is nighttime leg cramping. So like calf and foot cramping. happens a lot of times, and calcium can resolve that sometimes in as little as one dose. That being said, should you take calcium indefinitely at high doses just for the sake of bone health? No, because look, bone health, osteoporosis is not a calcium deficiency disease. It can be, but it isn't always. So again, testing, a good multi, good food, but testing is your best bet to really take higher levels of nutrients. As far as calcium magnesium ratio, 2 to 1 is a good ratio, but it's, sometimes a person is calcium deficient but not magnesium deficient, and vice versa. So you don't always even need to follow that ratio per se. A lot of people get hung up on the ratios between nutrients. And again, if you're getting testing done, if your doctor's testing you, you don't need to worry as much about the ratio. You need to worry about correcting what's actually low. Yeah, right. I know Miguel, he said LMAO, right? Because, how many doctors actually do this stuff? Look, nutrition is not sexy. It's not like a surgeon. It's not like jet pilot or jet fighter pilots, right? It's biochemistry. It's hard work. It's a lot of knowledge. It's a lot of books. It's a lot of studying. And so most doctors don't gravitate toward it because it's more than what they want to get into. And most doctors, well, I don't want to generalize for all of them, but the vast majority of my experience is most doctors spend 5 or 10 minutes with a person, don't have any nutritional foundation, don't know anything about nutrition. And so the only thing they really ever share nutritionally is how unimportant nutrition is. So like if you go to your doctor and say, hey, does nutrition have anything to do with my joint pain or my bone loss? They're like, no, just take a calcium supplement and take this medication. In essence, they tell you nutrition isn't important, but not because it isn't, but because they just don't know any better, and so they can't engage in that kind of conversation. So I can understand how a lot of you might be frustrated in that regard. Is there any way to reduce or reverse bone loss once you already have a great deal? Yes, you can improve your bone density. Your bone, again, it grows based on pressure. So can you reverse bone loss? You can, but you've got to work at it. It's not one of those things that you can do passively. Some people want to just pop pills. Remember, popping pills is passive therapy. Bone, in order for it to grow, you have to have activity. So passive therapy is great to support the nutrition, but again, you're not going to grow denser bones by popping calcium pills or any of the other supplements that I'm talking about here if you're not combining it with sleep and exercise and stress management and solid food. And that takes work because we live in a society where convenience is king. Everybody wants what's quick and what's easy. And remember, those that work hard for things, it's worthwhile, right? Work reward. And so you've got to put in the time, you've got to put in the effort if you want that reward. So don't just think that passive supplements are the answer. Let's see. Gloria, that question, good question, but it's way, way, way too complex, to answer in this format. I don't want you to think I'm ignoring you, but that's probably more of a question to ask a doctor. And if you're looking for deeper help, call my office and talk to my people. Okay. Let's see here. Let's go down a little bit more there. Why does bone hurt if you're gluten-free for a very long time? Back and joint pain. I'm just 50. Well, if you're gluten-free, I don't necessarily think you can equate being gluten-free to your bone pain. And remember that not all bone pain is caused by gluten, and gluten-free diet doesn't necessarily cause bone pain. So if you're struggling with back and joint pain and you're relatively young, then get with a good doctor to figure out why. That's really it's a simple question, but there's a complex answer, because if you're struggling, it could be a number of different things that can be causing your pain. And certainly nutritional deficiencies at the top of the list. Food allergies could be part of that as well. So could things like lack of activity or sedentary lifestyle. So again, there are a number of different things that could contribute to that. Let's keep going down on that side. Too much thyroid. Okay, so Marie says, regarding too much thyroid, in previous talks she had mentioned recommended amount of protein intake can vary according to lifestyle. Could a similar logic apply to the recommended dosage of levothyroxine for Hashimoto sufferers? or is the TSH T4 the only reference to take into account? No, so that's a great question to what we were talking about earlier on TSH. I was simply using TSH as an example, not to say this is a comprehensive evaluation of thyroid hormone, because TSH by itself, or even TSH with T4, that's not comprehensive evaluation of the thyroid. There's 17 nutrients your thyroid needs to function properly. There's also T3 and reverse T3 that should probably be measured. There's cortisol that affects your thyroid that should be being measured. So there's a lot of things that go into evaluating, your thyroid hormone. But going back to your question, which is, by that logic, could a person need a different level of a thyroid medication based on their activity? And the answer is yes. Everybody's unique and everybody's different, which is why you got to work with somebody who doesn't just you can't work with somebody who just corrals you into the same line with everyone else and gives you the same dose as he gives everyone else or she gives everyone else, because one size doesn't fit all when it comes to health. Can collagen, let's see, I think I answered that on collagen. Vitamins to boost the effect of collagen, vitamin C, copper is very important. Zinc is very important. So zinc, vitamin C, and copper, probably the three big ones if you're trying to, take things that will also support collagen supplementation. So oldies who have some disabilities. So if you're an older person, you've got some disabilities, you can still do Tabata, you just have to modify it. And so one of the ways you can modify Tabata is, for example, if you can't do a push-up, you can lie on your back and you can use bands and you can do push-ups on your back. And that way you don't have as much stress or pressure on your joints. And if your muscles are really weak, you can kind of start light and work your way as you get stronger. It becomes easier. That's the great thing about working out, is the more you do it, the stronger you get, the more you're capable of doing. The less you do it, the weaker you get, the less you're capable of doing. So, many people are told by their doctors, hey, as you're getting older, you need to slow down. That's BS. As you're getting older, you need to keep going, because the second you slow down, look, as you're older, you're going to heal more slowly because of the fact of you're getting older. But if you slow down, it's going to be a lot harder to make a comeback as you're slowing down. So you want to keep going. Just don't keep going to such a great degree with your exercise that you injure yourself. Is there any one test that measures vitamin and mineral levels? No. There are tests that measure certain ones, but no. It's several different types of tests to get a really comprehensive look at a person's nutrition. Okay. How do I feel about strontium versus calcium? Maybe clarify what you mean by that. I mean, they're both important, and they're both important for bone health. Does nutrition for bones apply to teeth as well? It absolutely does. I've seen cases, interestingly enough, where people came to see me and they were told they had multiple cavities by their dentist, and they didn't want to get the composites or the silver amalgams put in. And so they made a decision to, let's just see what happens with nutrition. And I have several cases where when we got their nutrition really dialed in, their cavities actually, when they went back to their dentist to get another checkup, they weren't on the x-ray anymore. So I've seen cases where, and I would say with that, it can depend on the depth of the cavity. Because if you've got a really, really deep cavity, you're probably not going to see nutrition change that. But if you've got just some small ones, you might, again, you might see some changes with nutrition, because your bones, your teeth are bones in your mouth, right? Let's see here. So lots of you asking about remineralization of teeth. The problem with teeth is that once you lose them, they're gone. So taking care of them, obviously prevention is your best method, but a lot of people lose the density in their teeth, or they lose mineralization of their teeth because of high acidic foods, high sugar-based foods, just bad food choices as a whole. And not eating well. So can you reverse the damage of not eating well? Yeah, if you catch it early enough. But if if your teeth are hanging on by, a thread of collagen, they're getting ready to fall out, you're probably not going to reverse that just by changing your diet. You've got to catch it early enough where the body has the ability to adapt to the changes. Should estrogen supplementation be considered for postmenopausal bone loss? Possibly. That would be a good question for your doc that you're working with. My advice would be to measure your estrogen levels. Don't just randomly start taking hormones. Hormones are powerful drugs, and you don't just want to take them just for the sake of popularity. You want to take them, based on need. Let's see here. Yeah, so I hate to hear that. So my husband has major bone loss due to paralysis. Legs were amputated. Would sitting on a vibration plate work if he couldn't stand? So the magic of it will help his bone density, but the magic of a vibration plate too is doing the resistance activity on the plate itself. So if his arms are strong and he can use his arms, so you can actually kind of straddle that vibration plate, and again, depending on the amputation, he could do things maybe like abdominal lifts with it, in a dip type position. So there are a number of things that could be done with a vibration unit. Okay, let's see here. Would you please speak to the issue of estrogen replacement? I think I did. I think I talked about that already, so that question's come in a couple of times. Okay, yeah, we've got questions that just keep coming, folks. We got to wrap it up. We're running 10 minutes over. So, look, thanks for being here with me tonight. Thanks for sharing your Monday evening with me. If you know somebody that this information can help, please share it with them. Our goal here is to, reach 100 million people. We're trying to save 100 million lives. I can't do that without you. So if you appreciate me, show me that you appreciate me by sharing this information with as many people as you can. And if you haven't already, come visit me at glutenfreesociety.org. Make sure you sign up for our newsletter. We've got the world's largest gluten-free newsletter to help you navigate a grain-free, gluten-free diet to improve your health. And we'll send you a bunch of really great recipes and starter points on how you can get going on the diet. And make sure you subscribe to the channel here so that you can get posted updates when we publish new videos. And look, it was great spending Monday night with you. We'll see you next week for another episode of Pick Dr. Osborne's Brain. Have a nice evening. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.